Hi, good afternoon, everyone. My name is Krishna, and I am from the marketing team of Newburgh Diagnostics. Thank you for taking out time and joining us today for a webinar on myths and facts about women's health and wellness by Dr. Umanam. Dr. Umanam is senior gynecologist with over 17 years of experience. She is the director and consultant gynecologist at Sripati Clinic and Hospital, Chennai. Her interests include high risk pregnancies, diabetes, twin pregnancies, and PCOS. She has won several awards and has been speaking at various national and international conferences. During the webinar, we would request you to keep your microphone on mute, ask questions only on the chat box, and we will try to answer all of them. Now, I would like to request Dr. Omaram to take us through our session. Thank you so much.
Yeah, good afternoon, everybody. Before I start, I just want to make sure that I'm audible to everyone.
Yes, ma'am.
Yes, ma'am.
Okay, thank you. Okay, so for the purpose of today's session, we're going to focus on some myths and facts on women and wellness. And once I go through the presentation, I'm quite happy to take questions. In this kind of a virtual online format, it's a little disruptive if the interaction keeps happening in the middle. So we will take all the questions in the end. So I'd like to kind of go through some of the common myths in a, let's say, timeline fashion with relation to the different phases of a woman's life. And one of the common myths that we come across is this belief that it is not good to exercise during pregnancy. It's a doubt that very many mothers have, and even if the young girl by herself is not affected by the period, there is a concern. There is a belief that if you exercise during pregnancy, actually the uterus can move down, that on the whole it's not good for you. That is absolutely not true. Exercise is quite safe during the periods. Of course, there are some young girls who have very heavy periods or very painful periods, and then they can rest in those days or just go for a walk instead of doing anything more intense. In fact, it's quite interesting that when you have young girls who actually come and complain of severe period pain, we find that specifically yoga and some form of regular exercise like swimming actually will help reduce the period pain. So we do advise certain forms of exercise as a preventive measure to reduce pain during periods. So rather than saying that we shouldn't exercise, it actually is helpful. The second, can I request everybody to mute your mics, please? The second misconception that I'd like to tackle is that anemia is actually a problem of the poor. Now, if you, because anemia is believed to be a condition that arises from poor nutrition, so how can, somebody from a reasonably well-to-do family be anemic? Unfortunately, that is not true. And anemia, if you look at our own national data, it says that nearly 60% of pregnant women are anemic. It is a contributory factor to a lot of mortality and morbidity. And it also results in problems when the woman does get pregnant, not because it increases the risk of the mother dying in pregnancy, and it increases the chance of having a preterm baby, a small baby. And the burden of, if you compare India to other countries within the Southeast Asian subcontinent, you'll find that even compared to Bangladesh and Nepal and Pakistan, we actually have a much larger percentage of women who are uh, anemic. And there is a large variation, and we do see a fair amount of anemia in the women who come to see us. And a lot of this anemia is actually iron deficiency, because even though it's not because they're economically poor, but the kind of nutrition that is given, the amount of iron rich foods that we eat, the way we cook our food, a lot of iron is lost. The other point I want to emphasize is there are some genetic anemias, and such as thalassemia, which are particularly prevalent in some communities, and therefore we need to be aware. So if in a family everybody is, sometimes we have women telling us, oh, everybody in my family is anemic. If everybody in your family is anemic, it's important to have a check and find out whether there is a genetic reason for that anemia. And anemia prevention is actually one of the MDG goals. And you'll find that for the 2025 target, the reduction of the number of anemic women by 50% is the target. I don't think we are anywhere close to that. Now, getting back to exercise, so when we ask women, what do you do for exercise? Many of them will say we walk. Some, increasingly, some say we jog or we run. But very few women actually strength train. And it's a common belief that women don't need to strength train. And that is not true. Now, men and women are certainly quite different in the way the body structure is, and in the fact that there are hormonal changes that happen in a woman's, both in terms of the monthly cycle and in terms of the different changes that happen through her lifetime. Therefore, the challenges that we have as women for exercise are slightly different. But in terms of muscle activation and what we need to do, while the amount and the nature of the exercise may be slightly different for men and women, strength training is extremely important for women. I cannot overemphasize this statement, because when we strength train, it's not like we are going to start looking like bodybuilders. That is not what I'm saying. But some amount of strength training is certainly important for muscle activation. This muscle activation improves what we call metabolic health. That is, it helps reduce our chance of diabetes, of having abnormal problems with lipids. It improves bone strength, which is an important concern as we get older. And we all think of osteoporosis as a problem of old age, but unless we build bone when we are young, we will not have good bone strength to compensate for the loss after we stop our period. So there are multiple health benefits, and strength training is something that women need to entertain. Now, moving on, to address some areas of one particular myth about contraception is this belief that the birth control pill is quite dangerous. Now, this is quite an old cover of the Time magazine, and this one statement says it all: the pill, which is so small, so powerful, and so misunderstood. And there is sometimes we talk till we are blue in the face about the safety of the pill, but people are not convinced. This is a slide that I like to share with women when I'm talking in groups, because this is the risk of dying per 100,000 women from different activities. And if you take what is the risk of dying from taking the pill, the risk is about 1 in 100,000 only. But if actually the risk of dying from having a baby in a country like the United Kingdom, where the chance of dying in childbirth is extremely low, is 6 deaths. In Africa, it's somewhere from 600 to 1,000 deaths in pregnancy. In India, it will be somewhere, depending on which state in the country you are, anywhere from about 1 in 100 to 1 in 500. So we don't tell our women that it is actually quite dangerous to get pregnant, do we? But we are all extremely scared about, you know, taking the pill. So the pill is actually quite safe and it has a lot of health benefits. Can I? Actually, a lot of health benefits, including cancer reduction. The chance of having ovarian cancer and the chance of having cancer of the uterus actually reduces when you're on the pill. And it also reduces the chance of anemia. The other common myth that women come to is this belief that any kind of vaginal discharge is wrong or bad. And they will say that, you know, they attribute everything, tiredness, exhaustion, um, weight loss, to vaginal discharge. So vaginal discharge does not melt the body away. Sometimes that would be a very nice way to lose weight, but unfortunately that doesn't happen. Majority of the time, white discharge is normal. It's just like some of us tend to sweat more, some of us don't sweat at all. In the same fashion, a lot of women have vaginal discharge, which is normal because there is secretions from the cervix and the vagina. Um, and some have none at all. There are some times in the month, such as just before your period and in the middle of the cycle when you're ovulating, where some amount of discharge will increase. So when is white discharge abnormal? When it is associated with itching, irritation, burning. Then you're worried whether there is an infection. Um, or when it is mixed with blood or it is foul smell, then you certainly need to check it out because that could mean a significant infection. Sometimes it could mean that there is a growth or something else developing, and therefore that needs to be checked out. Now, moving on to some myths about pregnancy. Working reduces the chance of pregnancy. Is this a myth or is this a fact? Actually, it's very, very common nowadays to have couples come in saying we're trying for a pregnancy, we are having, you know, should the woman stop working? And I always tell them that it actually doesn't help for just the woman to stop working because she can't make a baby alone. So it's important that if your work schedules actually prevent the husband and wife to spend time together and reduce the probability and the frequency of intercourse, yes, then working can reduce the chance of pregnancy. But per se, the woman going to work does not reduce the chances of her having a baby. Now, the other myth, other belief, of course, this is now changing. Traditionally, especially if you have older people in the family, they may say you don't need to go to the doctor right away. You can just go after 3 months. Now, that is not advisable because, firstly, pre-pregnancy checks are very important because they help us sort out problems. They help us identify certain concerns. It helps us give advice on preconception folic acid. And most importantly, by 60 days, most organ formation in the baby that is forming within the uterus is complete. So, 3 months may be too late. By the same token, today we have women who come to us like on 2 days after the missing the period and want to know if they're pregnant. Yes, we can do a blood test and tell you whether there's a pregnancy, but there's no way we can say that early. Is this pregnancy in the uterus? Is it growing well? And so there, it's too early. Also, doesn't help us give any information, but at the same time, it shouldn't be too late. Again, a lot of myths about exercising in pregnancy. There are clear benefits to exercise in pregnancy. There is a clearly increased risk from sedentary behavior because it increases the probability of diabetes, it increases the probability of blood pressure in pregnancy. And at the same time, there are concerns about increased risk from staying in bed. It's very common for women to be advised bed rest. There are doctors who advise it as well, I know. But families today are overprotective. They don't want the woman to climb stairs. They are worried about her sitting, standing. Actually, bed rest is known to increase the chance of preterm labor. The other concern about in pregnancy, and the other myth is this myth about back pain. Inevitably, 90% of women ask us if we take an injection in the back for pain relief or for anesthesia, if we happen to need a cesarean section, will it cause back pain? And I want to emphasize here that it is not the anesthetic that results in back pain. If you see, most of the time back pain is because of poor posture, and most of us have poor posture irrespective, even before we are pregnant. Now, when you're pregnant, because the abdomen moves forward, because your back is arching like this, your spine is curved, right? And this is why the lower back starts hurting. So if you stand with your shoulders held back so that your spine is tight and your tummy is tucked in and your knees are relaxed and not locked, then you reduce the probability of back pain. So the center of gravity shifts in pregnancy as the pregnancy advances. Plus, as I showed you here, the curve of the spine changes, the back muscles are stretched. If you have gained a lot of weight, then your body is also trying to compensate for that. And we must agree that most of us as women do not strengthen our backs before pregnancy. Even in the normal sense, we don't work our back muscles at all. We don't do any kind of push-ups or any such exercise which strengthens the back muscle. So an already weak back will have pain after pregnancy and delivery, and we don't exercise afterwards to bring in this tummy laxity in, and that is the reason for back pain. Now, postpartum blues are uncommon. Is that true? Actually, no. If you actually look at mood disorders throughout a woman's life, there are many situations which impact mood, and mood impacts many of these conditions, be it infertility, pregnancy, pelvic pain, postpartum period, menopause. As it can cause sexual dysfunction. It can impact the woman if she has a miscarriage. So there are many changes that can do so. And every woman's life, all of us, it's not as if men don't go through changes, but in a woman's life, there are very classical physiological changes that she goes through, each of which where there are hormonal impacts, and those hormones also affect the brain and the mood, and therefore it is more common for women to be affected by mood disorders. So hormonal influences are certainly important in pregnancy, especially in very early pregnancy and in the postpartum period. But these changes affect some women more than other women. So on the base of it all, yes, there is hormonal changes, but this is layered by other factors such as family relationships, work-related stresses which are playing when the woman is pregnant. It could be a shared or experience or a past experience from pregnancy which has not been pleasant. And of course, if there are additional pregnancy complications that add on, all of this affects mood. So it's very common. Actually, nearly 20% of women are affected by some form of low feeling or depression in the postpartum period. Usually, in about a couple of weeks, this will settle down, and that's what we call postpartum blues. You don't need to seek help for that. It's also layered by lack of sleep, feeding difficulties, etc. But if it persists beyond 2 weeks, then certainly it requires help. Now, moving on from pregnancy on to the more mature woman, one of the biggest myths that we believe is women don't get heart attacks, and that is not really true. Women actually, at least till in in the premenopausal period. So, yeah, true, younger women don't get as many heart attacks as men, but after menopause, that protective effect of estrogen is lost, and therefore they can get as many heart attacks as men. But even if they don't get as many, they are at greater risk from heart attacks for many reasons. The first is they're more likely to have atypical presentations. So that means they won't present with typical chest pain. There may be indigestion or tiredness, and they'll just put it down to tiredness or indigestion, and therefore they won't seek help. Yeah. They are less likely than men to obtain preventive recommendations for heart disease from their physicians, because physicians themselves don't address protective heart disease, even if women choose to go and have a checkup. Majority of women don't. They're less likely to have aggressive management of their risk factors, such as cholesterol, with medications. When they do get the heart attack, probably because their vessels are smaller, they have additional comorbidities, they have a higher mortality and morbidity, they are more likely to have a second heart attack, and they're less likely to receive timely intervention during a heart attack than men. So we have to be very, very careful about our cardiovascular health. And those women who are more at risk for heart attacks are women who have had in pregnancy blood pressure and sugar. If you are somebody who has had pregnancy induced diabetes or preeclampsia or high blood pressure in pregnancy, it is very, very important that you focus on your cardiovascular health. And if subsequently you develop diabetes or have blood pressure, then the risk of heart disease is much higher. A lot of women come for checkup during their reproductive phase, and they don't come back for checkups after menopause. So the first question I want to ask all of you is, when is menopause? When do you get menopause? Because I've had 42-year-old women who come because they've not had a period for a few months, and then we say, why did you not come earlier? They say, oh, I thought my periods had stopped. So the average age of menopause is closer to 50. So at 40 and 42, we don't expect periods to stop, and if they do, we need to seek help. Now, after natural menopause, it's important to have checkup for these 4 reasons. First is metabolic health, to make sure you don't have diabetes, don't have lipid disorders, to emphasize the importance of bone health, which is prevention of osteoporosis, to ensure that there are no, that mental wellness is good, uh, and there's no depression or anxiety, and most importantly, cancer screening for the breast, uterus, and ovaries. So with menopause, what happens is there is a lot of problems that happen with menopause, right? So uh, there are night sweats, there are hot flushes, there are mood swings, sleep is altered. At the same time, there is other changes that are happening in the home front. And so those layer the anxiety and the depression, and then there is weight gain. Now, this weight gain in menopause, is it an unfortunate inevitability, or is it our negligence? So it is important for women to understand that the metabolic process changes around menopause. Our metabolism slows down. So even if you're doing the exact same thing that you were doing earlier, I have had a lot of women tell me, my diet has not changed. I'm exercising the same, but I'm gaining weight. Yes, unfortunately, with menopause, there is a tendency to weight gain, but you need to step up your exercise regimen or modify it. And here again, strength training will work much more than better than cardio. And you need to adjust your diet so that weight loss is possible. And it is not impossible to lose weight or manage weight with menopause. And especially given the cardiovascular risk that I was talking about, weight gain is something that women needs to guard against. So this is a kind of a story that I'd like to present, because it's something that we see quite often. We have, let's say, a 42-year-old woman who presents saying that she has irregular heavy bleeding after 3 months of no period. And her BMI is 38, which means she's definitely obese. This is her blood pressure, which, as you can see, is a little high. Her sugars are high. If HbA1c is a value that looks to see how your sugar control has been in the last 3 months, and 6.8 definitely suggests that she has diabetes. Now, if you go back in her history, you'll find that very often she's had irregular periods and she's conceived on treatment. She's had gestational diabetes or pregnancy sugar in both her pregnancies, and she's had additionally high blood pressure in her second pregnancy. Fairly common story. I'm sure that if all of you actually think about it, there will be at least one person you know who has this kind of a history. Now at 42, she's already a diabetic hypertensive. She has abnormal lipids. She has had some ischemic heart disease. And because when the doctor investigates why she's bleeding so heavily, there is some abnormal hormonal changes with abnormal cells reflected in the endometrial biopsy. So, in along with her will be a 15-year-old daughter. This 15-year-old daughter can have irregular cycles and acne, also will be overweight with a BMI of 30. And even though we take the opportunity to tell this young girl about the importance of diet and exercise, at 15 and 16, when they are finishing school, their focus is not on exercise. Their focus is on, everybody's focus, parents, child's, is on cracking an exam, studying, very sedentary behavior. And so you'll find that by 23, when she comes in, there are concerns of fertility. Somebody's made a diagnosis of polycystic ovaries, she already has a tendency for slightly high sugars. And the story goes on. And if any of you have seen this movie called Groundhog Day, that you'll remember that there is this man who wakes up every day to the same story, to the same day in his life. And then slowly he understands what he can do to make that day go better. So we don't need to go through, for this young girl to go through the same thing that her mother went through, to develop diabetes and hypertension when she's 42, if we can advise her and impart upon her the importance of diet and nutrition. Which brings me to the last few points before we open up for discussion, which is the importance of nutrition, vitamins, and calcium. Now, eating, actually, to have healthy eating behavior, it's not enough to just tell one person. You have to have the buy-in of the person who controls the kitchen, and the entire family has to eat healthy. To prevent anemia, iron-rich foods are very important. And for example, people think spinach is a very good source of iron, but actually murunga kira and then mulika patta, these have more iron than spinach. Calcium is there, yes, in milk and curd and cheese. But today we are having a lot of people becoming vegan, and therefore they need to get additional calcium from other sources. But there are two phases in a woman's life where calcium supplementation is extremely important, and that is pregnancy and menopause. And as I mentioned, in the pre-pregnancy period, B12 and folic acid. So this, along with exercise, can be the most important way in which we can stop the process of ill health setting in, and it's extremely important that we focus on these issues. So I'll stop there, and I hope that I've been able to move the mist away from some of the myths and given you a clear picture. I'm happy to answer any doubts that you have now in the discussion period.
Thank you so much,
Thank
ma'am.
you.
So my colleague Maria would ask questions from the chat box. Maria, you there?
Yes.
Yeah, hi, Krishna. So, ma'am, I'll just read out the few questions that have been posted in the chat box.
Okay.
The first question is, it's more a statement. People say lifting a little heavy weight is not good for women as it affects your reproductive health and uterus. That's more a statement than a question.
Yeah, but I can take that to say that 1 minute, sorry. I did address that in my initial statement to
Yes.
say that that's not true. Just because you lift some weight, you're not going to have the uterus come down. For sure, no.
I'll go on to the next question by the same lady.
Sure.
She says, too much training shouldn't be done as you're nearing your menopause, etc. Is that true? What are the things that should be taken care of during menopause?
What do you mean by too much strain? I don't think there is see, obviously, if you have a bad back, if you have not strengthened your back, and then you suddenly go and lift 10 kilos, certainly you're going to sprain your back, right? So in order to be able to do that, you need to invest in exercise, correct posture, form, and then you should be gradually going up to lifting weights. So for example, when we ask women, do you exercise, they say yes, and we ask them, okay, what do you do when you exercise? And often the answer is we walk. How long do you walk? Half an hour. At what speed? So if you're actually just doing a nice amble where, in 30 minutes you're just walking 1.5 kilometers, that's not exercise at all. That is physical activity. If you want exercise, then you should be doing at least between 2.5 to 3 kilometers in a half an hour period, right? So uh, uh, even in menopause, there is no restriction to lifting weights or straining, provided you are fit enough to do it. And if you are not fit, you need to gradually build your strength to be able to do that.
Next question, ma'am.
Yeah.
Suggestions for hot flush during menopause. And is it normal to have white discharge little more during menopause stage?
Say the first part of the question, please.
She's asking for suggestions for hot flush during menopause. And is it normal to have white discharge a little more during menopause stage?
Okay, so I'll do the second one first because that's easier. There can be some amount of white discharge around menopause, but if many years after menopause you have a lot of discharge, let's say much older, somebody in their late 60s, early 70s, like after a good 6-7 years of menopause or 10 years post menopause, suddenly there's a lot of vaginal discharge. That is a cause for concern that needs to be addressed. Around the time that menopause is happening, some amount of vaginal discharge is normal. In any case, if you're somebody who's regularly having pap smears and those smears are normal, you don't have to worry about vaginal discharge. Coming on to hot flushes happen because your estrogen levels are coming down. Everybody who goes through menopause will go through hot flushes. Some women have it worse, and if you're having hot flushes and they are affecting your day-to-day work, then there are simple things that you can try. We say with regard to diet, cut down tea, coffee, reduce starch and carbohydrate, some form of yoga or exercise. There are medications that we can give you which may help you tide over the hot flushes. In worst case scenarios, if somebody is having, let's say, 10-15 times during the day, they're simply not able to manage, then we do give short-term hormone replacement therapy.
Next question, ma'am. It says, how to prepare a body to plan for pregnancy?
How do you prepare a body to plan for pregnancy? I think few things we need to do. First is we need to ensure uh, that there are no medical problems that are already present. So the common things that we check for are for diabetes, blood pressure, and thyroid. Sometimes there are genetic problems in the family. If they happen to be there, then those are things that the family needs to highlight to us so that we can advise appropriately. But as a rule of thumb, it's important that you're as close to your optimal body weight as possible. And certainly, you're not starting off pregnancy being far more overweight or obese. And this is because when you start off with a very high weight, you're increasing your chance of complications in pregnancy. Folic acid, as I said, is something that we give. We'd like to check immunity to rubella or German measles, because if rubella infection happens in pregnancy, it can affect the baby significantly. So we screen for immunity to rubella, the other blood tests, and increasingly, I know I'm sounding like a stuck record, but increasingly we end up having to give weight-related advice.
The next question, ma'am.
Yeah.
What vitamins, calcium, do we have to take after age of 56 for a diabetic person?
So certainly calcium you need to take. I think you need to check, especially older diabetic, you need to check vitamin D levels and make sure that those are corrected along with the calcium intake that is happening. B12, B complex vitamins, I think, are a good idea in general. Other than that, you don't need to specifically take anything. Any one multivitamin which has B complex is good enough.
The next question is, how do you manage hormonal changes during pregnancy and periods, and how to reduce it during periods?
Well, most of the time the hormonal changes are par for the course. So I actually don't understand the question very clearly. What is it that we want to manage? If it is the impact of the hormones on mood, then part of it is learning to accept that this is going to happen and learning to deal with it. If it significantly impacts mood, then we do give some kind of techniques to help, and in extreme situations, we advise medication.
The next question, how long should one wait to decide about fertility treatment for pregnancy if having PCOD?
I think that's a good question, because it's a common problem. So it depends on this diagnosis of PCOD. First of all, that it is an accurate diagnosis, because today most people end up having that label without actually having the problem. So if you have polycystic ovarian disease and you have irregular periods, then if I would say if you have been actively trying for a pregnancy and in 6-7 months nothing happens, then go and meet somebody, because they can look at the whole picture and advise whether anything needs to be corrected so that pregnancies can happen. In general, we say give it a year. But if we know there is a problem, then I think in about 6-7 months, it's worthwhile having a check.
The next question, can hormonal changes and blood compatibility lead to erythroblastosis
fetalis condition? Yeah. So hormonal changes have nothing to do with erythroblastosis fetalis. For those of you who don't understand the term, this is a condition which develops because of a blood group incompatibility, which is usually the Rh factor incompatibility between a couple, and typically happens in the second pregnancy. Very rare for it to happen in the first pregnancy. So it is a blood incompatibility issue, and hormones have nothing to do with it.
The next question, Migraines and insomnia seem to be more in menopause. So any tips for that?
Actually, migraine, if it is related to hormonal cycling of the period, will get better with menopause. It won't get worse. Sleep disturbance is part and parcel of menopause. So some of the ways to manage it is to do some form of yoga, some calming meditation, set into a routine, and it, uh, uh, that's the first line usually. But if sleep is particularly affected, significantly affected, then short term we can give medication. But most of the time, if you get into some kind of a pattern and uh, work on stress reduction, work on meditation, or some form of calming exercises, that helps.
There's a question on nutritional requirement for a lactating mother.
Yeah, so certainly a lactating mother's nutritional needs are slightly different. She does need more calories because uh, a lot of calories are going into the breast milk. But it's important that this calorie comes largely from protein and a lot of vegetables, and not from fat. So, and you don't need a huge amount of extra calories. So, what you need is about maybe 800 to 1,000 calories more. You need calcium, about a gram of calcium more, and you need a lot of fluid. So it's very important to hydrate because lactation is very dehydrating, and it is known that when water and fluid intake is restricted, and in many communities they restrict water and fluid in the lactation immediately after delivery because they believe that it will cause infection. Um, this kind of restriction actually results in blood clots in the brain. So, in many traditional diets, they give a lot of high calorie. I'm sure each laddu will be about 500 calories in itself. So, it's those are way too much. Again, certain other traditional diets give no protein of any sort. They will not include the dals. So, those are not good. You need to have enough protein in your diet.
There are a couple of questions on PCOD and PCOS. I'll just bundle them together. So one person has asked if PCOD is hereditary. Another person has asked if you can throw some light on the myths and facts of PCOD. And the third person has asked whether regular clotting bleeding comes under PCOS, and does it affect fertility if it continues? And any nutritional suggestions? So all related to PCOS.
So PCOS could be hereditary. It's not always hereditary. It could be hereditary in the sense that there is the crux of PCOS is insulin resistance, which means that while the body is producing insulin, the insulin doesn't work very well on the ovaries, and therefore egg formation or ovulation does not happen. And this then results also in a slight increase in the male hormone level, and this combination results in the symptoms of irregular periods, weight gain, increased facial hair fall, etc. So just because the ovary looks polycystic on ultrasound, it does not mean that the woman has PCOS. That's the first thing I want to say. So it's a combination of symptoms and that which result in the diagnosis, and it is essentially a lifestyle disease. And while we give hormonal medication to rectify the problem, the only way in which we can actually help correct it is by addressing this core issue of insulin resistance, which will come with weight management and exercise. if you're bleeding regularly, it's very unlikely that you have PCOS, which can affect fertility. Yeah, so the reason fertility is affected in PCOS is because periods are irregular and ovulation is not happening.
Should I move on to the next question?
Yeah, yeah.
Any solutions for breast tenderness?
I'm assuming that's breast tenderness before the period. It's very common because the breast tissue acts or reacts to the changes made by progesterone hormone. So the breast tenderness can be corrected to some extent by, sometimes we give supplements like vitamin E or evening primrose oil. It helps a few people, it doesn't help a few. Now, if there is very severe breast tenderness, then sometimes we do a few cycles of the pill because what the pill does is it does not allow the normal hormonal cycle to rise and fall, and therefore the breast tenderness gets better for the same reason that it helps with mood changes also. PMS also gets better.
The next question, how to prevent pimples before the period?
Difficult, because if you have so skincare essentially, because again it's for people who have oily skin, because of the hormonal changes, it is pimples will form. So it's essentially skincare. Of course, women who have PCO, sometimes if they have true polycystic ovary, because they have slightly higher level of male hormones, they are prone to more acne. There we can do hormonal manipulation, but not on the normal skin eruptions that happen in adolescence. You just have to wait it out.
There is one more question on menopause. It says, what are the menopause symptoms other than the ones mentioned in this talk?
I think I've pretty much gone over most of the symptoms that are linked to menopause. I think women tend to blame everything on menopause. That's not necessarily true. So the commonest are hot flushes, excessive sweating, feeling loss of energy. Probably that's the only symptom that I've not mentioned. When estrogen levels go down, there is a significant loss of energy. And that is something, especially working women, women who are in very high stress jobs, they find very often they say, doctor, we're just not able to find our energy levels. And that is the lack of estrogen. Unfortunately, we just have to give nature time to find the balance and work it
out. So the next question is, working in night shifts will affect the chances of pregnancy?
Same, my response is the same to the question on work, because if the husband and wife are on different shifts, then simply because that makes intercourse less likely to happen, it will affect pregnancy. And as long as one is able to have intercourse around the time of ovulation, whether you work night or day actually should not matter. But in a practical sense, the reason it does is the fact that the two are not together. And sometimes if you're on a very crazy kind of a schedule, which reduces your sleep, that can affect ovulation.
So there's a related question which was sent to us during registrations. It says, is that true that while working on computers or laptop, that your egg production reduces?
No, it does not. But egg ovulation does not reduce. But the point to remember, as long as the system, and this is for men, not for women, it does not affect egg production, but it can impact sperm production because the laptop generates heat. I'm not talking about a system that's on the desk or a laptop that's on the desk, but many of us have this habit of keeping the laptop on our thighs or on our abdomen and working. Now, when men tend to do that for prolonged periods of time, the heat that is generated from the laptop potentially can reduce sperm counts. And I mean, traditionally we say, men who work in foundries, factories where there's a lot of heat generated, we worry about its impact on sperm production. But by the same token, because of the proximity of the contact, it can affect, but not for the women. I mean, there must be some things that we are immune to, right? So,
So I'm just getting a couple of related questions. Moving on to a question by a 15-year-old. It says that she feels cold while she gets her period. So she wants to know what is the reason.
yeah, I think when you say you're getting a cold frequently, it's like you're getting uh,
Cold or feeling cold? I'm not
I
sure.
don't know if she's feeling cold. Yeah, so again, some people do have a tendency to catch a cold close to the period cycle. There's no specific reason for it. Um, as long as the cycle is regular, you're not actually developing a fever. I don't think there should be anything specific to be done. You can try some ensuring that your diet is good, that you're having enough calcium and enough milk and curd in your diet, and possibly some vitamin C. That could help.
So the next question, how can we determine the periods in young girl is normal?
I mean, if the cycle comes at regular intervals, anybody who's having a regular period that let's say once in 25, 26 days, till about once in 35, 38 days, uh, in a reasonably regular fashion is fine for her. The period of bleeding again can vary. Sometimes it's just 2, 3 days, sometimes it's 5, 6 days. It doesn't matter as long as it is regular for that person. If there's very, very heavy flow, flooding, clotting, which is making her tired, if there's intense pain, if the cycles are less than, like coming more frequently than 23, 24 days, or getting delayed beyond 45 days, or if there's bleeding in between cycles, then you seek help. Otherwise, consider it as normal.
There is a question from one of our audience who says that you mentioned about strength training during menopause. If you're a little bit more specific with respect to which area of body, it will be helpful. And also nutritional suggestions for menopausal period.
Okay. So, so the strength training needs to be for the entire body. The biggest muscles that we have in our body are actually our back muscles, abdominal muscles, and our thigh muscles. And these are the three largely that we need to train. And the exercises that you need to do when you're strength training to work these muscles are squats, push-ups, and core strengthening exercises. So these are the three specific exercises. And if someone has not done these exercises before, then it is very important that it is learned and done under supervision. It's okay, you can start this at any age. A lot of women worry but about starting it at a later age. But it can be done as long as it's done under supervision, where someone is correcting your form and allowing you to progress slowly. Just using dumbbells and doing upper arm weights or leg weights is not enough, because these are much smaller muscles, and it's the larger body muscles that you need to work. Nutritional suggestions for menopause, I think I went over it. You need, specifically, you need the additional calcium, but you need to adjust your diet, reduce the carbohydrate, increase the amount of vegetable, and increase the amount of exercise, so that there is adequate compensation for the slowing of the metabolic rate that happens with menopause.
So just related questions on Facebook. Is bloating common in menopause? And one more related question here, asking for home remedies for breast pain during menopause.
Okay, bloating during menopause is a significant problem which a lot of women face. Unfortunately, it's a question of trial and error, uh, and most of the time we just have to sit on our hands and wait it out. Um, diet, reducing the amount of oil and starch in your diet uh, is helpful for sure. And we need to make sure that there's no other reason for bloating, that obviously the blood pressure is okay, renal function is okay. Those things we need to check out. We make sure there's no thyroid dysfunction, because there are other things that can happen at the same time before we just put the blame on the menopause checkbox. So, and essentially that's what we do. We check all of this, and then give some dietary advice, and then see where it goes. But for a lot of women, nothing helps. You just have to wait it out, that 6 months to 1 year that it takes, and then it will settle
down. The next question, whether male known diabetic condition will affect in getting pregnant, and will it affect the baby's health?
So if the man has diabetes, in general, it will not affect the baby's health in terms of causing any abnormalities. Whereas if the woman has diabetes which is not well controlled, yes, it can increase the probability of abnormalities. But if a man has diabetes that is not well controlled, it can affect the sperm count and motility, and therefore reduce the chances of a pregnancy. So it's important that the control is good. Genetically, when either parent is diabetic, definitely the child, when that child becomes an adolescent or an adult, there is an increased possibility of diabetes. So to that extent, yes, it can affect, but not causing abnormalities in the baby.
The next question, it says that we are planning for a baby for the last 6 months. Now I am getting strains last 5 days, and today is the 28th day. Is this a sign of pregnancy, or will I get periods now?
So in these kind of forums, actually, it's very difficult to answer specific clinical questions, because one needs to, it's probably not right to respond to a specific clinical query. Having said that, if it's just day 28, I think you just wait and see. I don't know whether you're going to get, nobody will know whether you're going to get your period, whether it's going to start or not. So just wait it out, give it another 3-4 days. If the period does not come, then let's say even by day 35 and you're still spotting, then go and have it checked.
The next question, should should be any treatment taken by young girls unmarried for PCOS when number of cycles are 4 in 12 months? And what should be done to overcome the symptoms other than medical treatment?
So in general, we'd like for women, young girls, women to have at least a cycle once in 3 months. And so if somebody is getting 4 cycles in 12 months, they probably are getting there. Depends on her age. If this is a young girl, in the sense if she's like 13, 14, and this is happening, I would say make sure there's no thyroid problem. Encourage her to be more physically active, watch her diet, give it a couple of years. If she's 17, 18, and this is happening, certainly I think it's a good idea to work up, make sure that there isn't anything else happening, and try and ensure that she gets her period at least once in 2 months. So much so that there are at least 6 periods in a month, in a year. And as I explained, the only way we can actually rectify the problem is lifestyle change for PCOS. Anything else we do is temporary. We can give hormonal medications. We can give some medication to improve insulin sensitivity. Those are all short term. They have to internalize and lot of girls and young women who have managed will classically, they will tell you, yes, when I exercise, when I go to the gym, when I'm not stressed out, my periods come far more regularly. When I hit exams, when I stop exercising. So it is a lifestyle issue. They need constant motivation, and while it is important that we are focusing on periods and fertility, I'm more worried about their long-term health, and so it's important to get them to buy into this. This change will not happen unless the girls buy in and take responsibility for their own health. My prescription or a mother saying you need to go exercise is not going to be helpful. And I tell a lot girls to pick what they want. If it is dance that you like, go dance. If it is cycling, badminton, swimming, pick an activity that you will stick with, and then take it from there.
So the next question, does intercourse around the implantation time in any way cause miscarriage?
No, does not.
Okay. One of the questions from our registration question bank, how normal is spotting or bleeding in the first trimester, that is 5 to 6 weeks, and how to deal with it?
Spotting is fairly common. Slight bleeding, spotting in early pregnancy is fairly common. Most of the time, it's nothing. It does not impact the pregnancy in any way. When someone has slight bleeding or spotting in early pregnancy, the two things that we need to find out are, one, that the pregnancy is growing within the womb, that it is not a tubal pregnancy. That's the first thing. So once we know, and the only way you can find that out is by doing a scan. So once we know that it is not a tubal pregnancy and the pregnancy is within the womb, most of the time, everything will be normal. Rarely, it could be an indication that the pregnancy is not going well and there's a chance of miscarriage. But to date, there are no medications that we can give to prevent the problem. So we usually just wait and review. And most of the time, things will settle.
So I think we're almost at the last couple of questions. So one question on the chat forum, which lubricant gel or oil to use during intercourse? Can we use coconut oil?
I mean, per se, any lubricant that works for you is fine. But if you are trying for a pregnancy, then just make sure that the lubricant that you're using does not have any spermicidal jelly along with it. So most of the lubricants that are commercially available should not be an issue. Oil, again, should not be an issue.
I think the last question, ma'am. What one can take as a basic calcium supplement after 30 years for bone strength?
At the age of 30, you don't need calcium as a tablet for bone strength. Just make sure you're having enough milk and curd in your diet. If you're vegan, then, or you've gone off milk and dairy, then look for sufficient sources such as broccoli, almonds, things like that. Any calcium supplement that gives, you need to check that you get at least 500 milligrams of elemental calcium. Most brands are similar, but in general at 30 you don't need it. You can get it from your diet.
So I think that's all questions, ma'am.
Okay.
It was a wonderful session. We really learned a lot. It was very, very educative. Thank you so much for your time. You've always been very kind to us. This is your second session with us. And thank you, audience, for tuning in and listening in patiently. The session is available on Facebook page of Newberg Diagnostics. So if you wish to listen to Doctor's session again, please do visit our page and you'll be able to listen. Thank you so much. And
Thank you very much. And thank you to everyone for asking so many questions and making it interactive. Thank you.
Thank you, ma'am. Have a wonderful evening. Bye-bye.
Bye-bye.